Hey, everybody. This is Cheryl Cooper with Cheryl Cooper, and today I am here with Dr. Sonza Curtis, and I'm so excited. This is one of the most important interviews that I'm going to do through this Masterclass 1111 Women in Wellness, Healing Your Body, Mind, and Soul. So, Dr. Curtis, thank you so much for being here with me. Tell us a little bit about you, your business, how you got started, all of that.
Well, first of all, I want to thank you for having me, Miss Cheryl Cooper, and all the beautiful ladies out there. We're going to talk about healing your body. But I started my journey, actually, my journey found me. I didn't find it. My great grandmother was an herbalist and a midwife, and I went on later on. I went back to school to become a physician assistant after life was life and divorce. Single mother of two, went back to school, finished school, became a PA. And after doing a PA for probably almost a decade, got tired of giving a pill for an ill. And I'm like, there has to be something better. So then I pursued and actually found my roots with um, natural medicine and when became a naturopathic physician. And then later on, I went and got certified through the Institute of Functional Medicine. So I take all that and I put in a big pot and I come up with healing from the mind, body, and spirit, healing the person in three dimensions. That's why this is so in line with my destiny and how we connect. And so that is amazing.
I'm so grateful. So tell me this, because I know this might be a question that many of the viewers will have is what's the difference between naturopath, regular Western medicine, and functional medicine?
Well, regular conventional medicine, for one, you don't know anything about nutrition, so you're looking at signs and symptoms and you're treating with medication. Natural medicine, you're looking at your symptoms, but looking at the origin, what's going on, and you're treating with herbs. In Ayurvedic, you can look at like you're hot or cold, different things of that nature. Where functional medicine takes the whole gamut of everything. It's like they all get married, okay? They all have a big family. So functional medicine looks at the root cause of what's going on. And when we need to do regular medicine, we will. But the purpose is lifestyle medicine, where we're working on you as a person, working on your mind, body, and spirit, finding the root cause. And then when we find the root cause, you actually become the 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 key because you have to do the work. It's not like I give you a pill, you're going to get better. So there's a lot of things that you have to do. But as you find that in functional medicine, you become tuned with you, one, in your body, and you listen to your body. And we almost get ourselves out of a job. So that's the beauty of functional medicine. Once you get to the root cause and you educate your patient, then the patient now educates their friends, and then their friends come. So it's a beautiful gift of giving.
I love functional medicine, right? And I've been on the journey. You all, Dr. Sansa is my one of my doctors, and she was able to help me heal my gut during the pandemic and helped me to find some things out about my body that I didn't know. Had I had continued going down that route, who knows where I would have ended up. So I'm so still very grateful to you for that. The functional
Thank
medicine
you.
side is such a powerful side of understanding medicine. I think that one of the things that are important to understand about functional medicine is that when you go in to see a functional medicine doctor, you can talk to them about the entire body. You don't have to go to Dr. Sanza and then Dr. Cynthia and Dr. somebody else to get an understanding what's going on in your body. So tell us a little bit more about how functional medicine really works. I understand it's the root cause, but if I were to come to your office, tell us a little bit about what a visit would do.
Well, normally when patients come in, we look at, like you said, the whole entire person. And I want to see what's going on and what has happened between the time you were born, even some cases, preconception, while you were in the womb, and even preconception to see what's going on. Because whether we realize it or not, especially you said something about the gut, we get our gut microbiome from our mom. So it all depends on how you were born. So if you were born C-section, you were born into a sterile environment and your gut is at a disadvantage. Where if you were born vaginal, you go through the vaginal canal, and through that process, you inoculate, and your gut microbiome now is flourished. So that's what we look at. We look at you from all the things, and we try to just picture this. I know I'm telling my age here, but when you were a kid, you had to note the numbers and dots, and you had to connect the dots. So what we do in that history, we connect the dots, 1 to 2, 2 to 3, 3 to 4, and so on. And the more we connect the dots, the more we can see a big picture, or really what's going on. Like, okay, this preceded this, so this is the trigger, and this being the trigger, instead of trying to treat you up here, we may need to come back up here earlier in the trigger phase and work on that before we get to the end stage, which you come to the office and you present in. So we look at what's going on in your emotional state, because the emotions are always moving. Motions is moving, and they are stored in your tissue, in your memory, in your everywhere in your body. So a lot of times I do have to refer out to therapists, because I'm not a therapist, nor do I play one on TV. Uh, but the therapist will help both of us get to some of the things that are bottling up and that are stuck in your shoulder or stuck in your thyroid because you didn't have a voice when you were a kid, because something happened to you, traumatic, trauma. So that's what we look at. We look at the root cause in a artistic, picturesque way to try to treat you from the area that's going to give us a bigger impact, and then layer on the next therapy.
Right. That's good, Dr. Sonza. That's really good. So when someone is dealing with, I'm going to just kind of recap what you said. If you're dealing with a shoulder issue, it could be that the root cause is at your emotions. So you may send them out to a therapist, a psychologist, psychiatric therapist, or it could be that you could send them to a health coach,
Mhm.
but not for a shoulder, right? So you send people to different other providers as needed so that the whole body can be addressed, versus having to get a referral to another doctor that's going to go to another doctor that may prescribe a pill to you to get you to the root cause of what's happening. Is that correct?
That is correct. That's correct.
But you all did not to say that blood work isn't done, because I have a thyroid issue. So I go, and Dr. Sonza and her team will run my blood work for me and will adjust my medicine up and down however it's needed. But in the meantime, we're always working on or talking about other solutions that are possible through our mental health and
Yes.
aligning our spirituality. I'm sorry, go ahead.
No, and that's the thing. We test it when we don't guess. But when we do all that history, I don't know if anybody's out there ever been to a functional medicine doctor, but a lot of times you will go to some, and they will order a gamut of tests, and they will order tens, fives, and $10,000 to get a baseline. Well, I'm a little bit different because I use your history, and as your history, then I find the modalities that's going to get a bigger impact. So I always get blood work, but there's always other things that we look at. But I always start with healing the gut, because that is the epicenter, and that's where inflammation is initiated, and that's where we can end inflammation. So I already know that you're not absorbing your nutrients if you come in with the typical gut symptoms, constipation, diarrhea, gas and bloating, skin issues. I already know you have gut issues. So I'm not going to test for gut issues. I'm going to do a basic 30-day gut reset, and then calm the inflammation down. And then now we're going to go in and we're going to test a little bit more detail. And now our tests can be more precise, because at the end of the 30 days, Miss Cheryl, if you come to me and say, you know what, Dr. Curtis, I'm feeling wonderful, then why should I go order $5,000 worth of tests. Now, I do get the basic wellness panel, which is 50 times bigger than whatever you're going to order at your primary care doctor. So we look at your thyroid, we look at your hormones, we look at your nutrients, vitamin D, vitamin B, we look at your adrenals, we look at your lipids, we look at your inflammation markers. And so the gamut goes on what we look at. So with that panel, just by looking at your basic CBC panel, we can look at that from a total different lens than what your primary care will look at, because now we're looking at optimal ranges, not the range. For instance,
Oh, that's interesting.
yeah, your thyroid, when you look at the gamut of thyroid, the thyroid numbers is 0.45 to 4.5. That's huge. So that's a huge range where most people say, well, we'll wait till you get to 4.6 to say you have hypothyroid. But I'm going to look at that progression. So if I look at you and you come in January, you come back in June, and I see your numbers climbing up, and I also look at the function because I'm looking at your free T3, free T4, all the panels. I'm not just going to order 3 thyroid numbers, which is typical. I'm going to order 8 to 9 of them because I want to see what's going on. Most women will go 7 to 8 years before they're even diagnosed with a thyroid issue. So we're going to look at those and eradicate that off the bat. But when you look at those numbers, again, it's like going to Macy's and saying, can I have a normal women's shoe? Now, question, Miss Cheryl, how tall are you?
Are you really asking me that?
You can give me, you don't have to give me
No,
your correct
I don't
height.
know. I
Okay.
thought you were gonna
Yes. How tall
five
are you?
foot. 5 foot.
So if you were to go in Macy's and wear a size 9, 5 foot, that doesn't add up,
Correlate.
correct?
Yeah.
It
Right.
doesn't correlate. So why are the numbers correlating to everybody on that scale?
Yeah.
So we looked at those scales from the optimal ranges based on you as an individual. If you're taking medication, that optimal range is tighter because you shouldn't be the same if you're not taking medication. If you're taking medication, I need you to be at the lower range, not at the higher end of range.
Yeah.
And we need to figure out what is the root cause. Maybe it may be heavy metals. It may be mold, microtoxins. It may be other things that's contributing to the thyroid that a typical MD is not even going to put on his radar.
Right. Because they're only trained in a certain specific area, right? So
Mhm.
let's just keep on that note for a moment and talk a little bit more about testing and hormones, because you're talking about thyroid. And for me, for my knowledge and what I've seen as a woman in menopause. So let's talk about the menopause cycle as well as hormones overall. And how do you work with people to get them to understand where they're at and how to balance them so that they can make it through whatever phase of the menopause cycle they're in?
Okay. The horror and the moans. Okay. So that is it's horror when those hormones decide to go either which way. And interesting, we focus so much on menopause, but all this, it goes all through life. You see teenagers, puberty, PCOS, all these other things. But we put a lot of focus on the towards the end. So interesting enough, you were in your grandmother's womb when your mom was pregnant because those eggs were there.
Oh,
Okay.
that's an interesting thought.
Yes. So that's why sometimes when you see more depression in postpartum depression with the females, because now I have double the hormones. Okay,
Wow.
so that's kind of how it starts, sometimes how it starts. So, but within that, perimenopausal, back to your original question, perimenopausal can last up to 10 years. Okay, so it's not a one and done.
What is
For
perimenopausal?
perimenopausal is 10 years where basically your numbers, your estrogen is starting to go like this. And as your hormones, your estrogen, your progesterone, your testosterone, as that starts to decrease, then that's when you start having the symptoms, because that's when the symptoms arise. And also during that time, those hormones are protective of our heart, and your hormones mainly from the from your from your hormones. They're all type of hormones, but your LDL cholesterol is the building block to your hormones. So it starts with your cortisol. Now, some hormones you make in the reproductive system. So that's your ovaries and your uterus, your ovaries and your uterus. And so those are made there. That's your estrogen, progesterone, testosterone. But you also, which is in that pathway, is cortisol, and which is made in the adrenals. And then you have DHEA, and they are your fight or flight. So it's interesting how stress, those are, we call them the stress hormones, they're in that pathway. So I don't know if you ever remember back in the day, if you had a test and you were really stressed out, you didn't have a period. Well, that's because that stress hormones wasn't firing enough, right? So DHEA is a precursor to testosterone. So for women, a lot of times you don't need to give them testosterone if their DHA is low, because you go back and you fix the adrenals, and you fix the adrenals and the hormones. Correct. Funny story about myself. Every time my adrenals were shot, okay, running a practice, entrepreneur, need I say more? You already understand. Everybody's out there understand. So as I was going through this time, my adrenals were shot. And I'm like, oh yeah, okay. I'm going through period. Now I don't know about you guys, but when I went through menopause, my regular cycle was horrible. So menopause was like, hey, I don't have that horrible thing anymore. I'm good. Didn't have really hot flashes. So when I went through there and I had yeah, I know.
I'm hating on her, y'all, because I got them. So, okay, sorry.
I know, that's okay. So when I went through there and I would fix my adrenals, I would have a menstrual period. And I'm like, I got to wait a whole nother year, so, but that just goes to show you, when you fix the upper stream, the lower stream now can work like it should. So, and so that's why the hormones, and then your food, the food you consume. A lot of times women, if you're in that menopausal or perimenopausal, I'm going to tell you, the two worst things that you can consume is wine and
Alcohol.
chocolate. Alcohol. Well, red wine is the worst, but alcohol is a number one. And then chocolate, the caffeine, coffee, all that. You will flash like nobody's business if you in there, because again, it's speeding things up, right? That adrenal, it's working on that. So diet plays a big role, making sure you get enough sleep. If you don't get sleep, and I don't know about you guys, that one got me where I didn't get the sleep. So that wouldn't get you. The other thing you'll see that our joints and our muscles are aligned with the hormones, like progesterone. Now, so if your progesterone is low, you see more frozen shoulder. Okay. That's why osteoporosis or osteopenia, that kind of happens. So you'll see that as your hormones dive, okay, then your bone density goes down. And so it's important to keep that. And the last thing I want to share about the hormones is brain health. The biggest other complaint that I get is brain fog. I got cramps, can't remember shit, right? So so you can't remember anything. So can I say that on there?
Already did.
Okay. So, and then those hormones, actually, I work with the Amen Clinic. And so a lot of women that are going through Alzheimer's or dementia, they will call me and ask me to put them on hormones, because they have shown that it does help with memory. And then, okay, one more thing, weight gain. Weight gain is like the mother of all mothers. You're doing the same thing, you're eating the same food, you're doing the exercise, but your body decides to go south. Again, that's with the hormone drop. So once you get your hormones in check, either with food, lifestyle, or if we have to do bioidentical hormones, we can do that as well. Most women come back and they get their life back, and then they pull in their husbands. Men go through menopause as well. It's called andropause, where their testosterone starts to go down as well.
Yeah. Well, thank you so much, Dr. Sons. I know you and I could sit here and talk forever about all of this. Tell us a couple of things in a pretty short time about what you all are doing in 2024 and how people can get in touch with you to, maybe do a telehealth session with you or something like that right now.
Well, right now we have a new team member, and she's doing like going over your results. If you just wanted her to go over your results, her name's Heidi. She's a PA, and just somebody to get a second opinion on that. So you can call the office at 678-621-8100. She's here on Thursdays. You can go telehealth, visit with her, and
Repeat
then
that number for me, Dr. Sanza.
678-621-8100.
Thank you.
And if you would like to come and see me as a full consult, you can also call that number. You can go to our website. We have a webinar that you can click on if you want a little bit more details. And that website is www.3 spelled out THREED wellness.com. Okay.
Awesome.
We got
And
some new things coming up for the 2024. We piloted a weight loss program. We worked with the company and we use AI devices to kind of biohack your system. We have 3 versions of that. 1, you can go online and do it yourself. 2, you can work with a health coach. And 3, you can actually work with myself and Dr. Satcher and the health coaches, and then we can help you um, liberate those pounds that have plagued you for a while.
awesome. Thank you so much, Dr. Sanza. I appreciate you sharing all your knowledge with us. So that's a wrap on this one, you all. Take care and watch the next one.